Estrogen gets a lot of blame, especially in the online hormone space, whether it's weight gain, mood swings, bloating, fibroids, or breast cancer. But let's be clear, estrogen is not the villain. In fact, it is one of the most powerful and protective hormones that we have. The issue isn't estrogen itself, it's unopposed estrogen or poor estrogen detoxification that can cause problems. So today I'm breaking down what estrogen actually does in the body, how it fluctuates wildly in our 40s, the signs of low and high estrogen, and how to support it. So estrogen is a group of hormones, the main ones being estradiol or E2, estrone or E1, and estriol E3. Estradiol is the most potent and dominant form before menopause. Estrogen plays a major role in bone density and strength, brain function, including memory and mood, skin elasticity, and collagen production, vaginal and bladder health, cardiovascular health, metabolism, and insulin sensitivity. And as estrogen declines, especially in mid to late perimenopause, and of course postmenopause, we often see issues like vaginal dryness, accompanied by painful intercourse, brain fog, forgetfulness, night sweats, hot flashes, anxiety and low mood, increased cholesterol, increased blood pressure, and bone loss. Estrogen isn't something to fear. It's something that I believe we need to really respect and support. In early perimenopause, estrogen can spike and then crash unpredictably, sometimes swinging wildly from day to day. That's why us ladies in our 40s may feel like we're on an emotional or physical roller coaster. Eventually, estrogen production starts to decline overall, especially after cycles become less regular. So by the time we're in menopause, estradiol levels can drop by up to 90%. So here's the kicker. Symptoms of low estrogen can actually show up before you stop ovulating. Remember, in this stage of life, we can have anovulatory cycles, meaning we don't ovulate every month. And that happens because we don't have adequate estrogen, which needs to peak in order for us to ovulate. So let me explain that a little bit further. Your menstrual cycle, say it's a typical 28-day cycle. Days 1 through 6 or 7 is your menstrual phase when you bleed. And towards the end of that, your estrogens should slowly start to rise in order to prepare your body for ovulation. But because our ovaries are slowing down production of our sex hormones, like estrogen, we may not have adequate production of it in order to ovulate. So then we don't ovulate, and then as a result, we don't make ample progesterone. It's kind of a vicious cycle, and why so many of us feel so lousy. So you may have low estrogen if you notice, again, vaginal dryness or discomfort during sex, recurrent UTIs or bladder sensitivity. You may notice that you're having to urinate a lot more frequently. You may notice dry or thinning skin all over your body, but especially your face. You may notice more wrinkles, just really thin skin, even around your eyes. You may be dealing with mood swings or really bad irritability. You're like super impatient with everybody around you. Everything bothers you. You may be dealing with depression, just really low mood or apathy. You may notice that you have poor memory or focus. I was just at a friend's for her 50th birthday, and we were hanging out in her backyard by her pool, and we were having a really great conversation, and we got interrupted. And then afterwards, we just looked at each other and we were like, what were we talking about? And we started laughing. But, it is really scary when you are an educated woman and there are certain words you don't remember. You can't finish your sentences, or you walk into a room and you're like, why the hell did I walk in there? We can joke about it, but it is kind of terrifying. At least it is for me. Then, of course, there's hot flashes or night sweats, which, of course, are going to impact your quality of sleep. There's also the decreased interest in sex. You may love your partner or your husband, but just are not in the mood. And of course, that's going to affect your relationship. And then, of course, there's joint pain or stiffness as well. Low estrogen can even cause dry eyes. Somebody commented on one of my videos recently asking how estrogen is tied to eye health. So I want to dig into this a little bit. So your eyes, especially the meibomian glands, which help produce the oily layer of your tears, and the lacrimal glands, which produce the watery layer of your tears, have receptors for estrogen, progesterone, and testosterone. Isn't that crazy? We literally have receptors all over our body for these hormones. As estrogen and testosterone decline, tear production can decrease and the composition of your tears can change. And that can cause dry eye, redness, discomfort, and even light sensitivity or blurry vision. So you're not imagining it. Estrogen helps to keep your corneas thick and stiff. So when estrogen starts to decline, the cornea becomes less rigid, which can slightly change the shape of your eye and temporarily affect vision clarity, especially during hormonal fluctuations. So testosterone supports the oil secreting glands, which helps prevent your tears from evaporating really quickly. So if you have lower levels of testosterone, that may mean that your eyes could feel drier or more irritated. So if you're in your 40s or early 50s and you're experiencing any of the symptoms that I just mentioned, estrogen hormone replacement therapy may be incredibly helpful for you. The key, of course, is personalization. You want to be working with somebody who understands hormones, who isn't afraid of estrogen, who really listens to your symptoms, who pays attention to your health history, weighs the risks versus benefits with you, and of course, discusses your goals. So there's different ways of using estrogen hormone replacement therapy. So there's patches like the Vivel Dot or Clamera, and these give you a somewhat steady release. There's ones that you switch out twice a week or ones that you switch out once a week. I personally prefer twice a week patches to get more an even dose. I just even noticed with the 2 per week that I was getting kind of a peak and then I could feel it wearing off until I had to change it again. So I didn't love that, but some women love the convenience of patches. Then there's gels and creams. So there's something like Divigel or Estrogel. And of course, these are applied topically to your skin. And you would use that daily for that consistent level of estrogen. There's also a spray called Eva Mist. I actually have it right here because this is what I'm currently using. I have no affiliation to any of these brands, by the way. I'm just giving you some examples. I really like this. I've used patches before. I've also used a compounded cream, which I'll get to in a second. And I've gone back to this now a couple of times because I just love the convenience of it. You just spray it on your forearm. It absorbs really quickly. The only other ingredient is alcohol. Some of the other options have inactive ingredients that you may be sensitive to, or they're just not that great. So of course, do your due diligence, do some research, and just pick something that works for you. There's also injections, of course, which are pretty commonly used, especially for women who can't seem to get their estrogen levels up at a protective level. So this is where I do believe that testing your hormones comes in handy when you're on hormone replacement therapy, to see what your levels are, where your levels are, especially when it comes to estrogen. And if you're taking it, you want to make sure that you're getting your levels up to an adequate level to protect your bones, your brain, everything, your heart health. There's also pellets, which I'm not a huge fan of, but again, if that's something that you really like because of the convenience, then that is your choice. It's just that with pellets, they tend to be a higher level, and once they're inserted, you can't adjust that dosing. You have to wait until that hormone wears off to get them inserted again and adjust the dosing at that time. And then there's compounded formulations, and you could do just straight estradiol, or you could do something like Biest, which is something that I have experimented with. I'm still not sold on it. I know there's a lot of people who love Biest. There's some people who absolutely hate it. At the end of the day, I think it's really what works best for you, and we are all unique. So Biest essentially is a mix of estradiol as well as estriol. Estriol is a weaker estrogen that may support the body's use of estradiol and help it go down the safer metabolic pathways. In case somebody has never listened to any other episodes that I've done, if you still have a uterus and you are taking estrogen, you have to take progesterone in order to protect the uterine lining so that you could reduce your risk of endometrial hyperplasia. One of our clients recently shared this with me, and I was kind of blown away. But this is why I strongly encourage you to educate yourself, because a lot of doctors do not know this information. A doctor said to her that if she takes progesterone, she has to take estrogen. That is not true. It's the other way around. If you take estrogen hormone replacement therapy, you have to take progesterone to protect the uterine lining. Even if you have had a hysterectomy and you don't have a uterus intact, progesterone still has benefits beyond just protecting your uterine lining. There's a lot of doctors who may say, you had a hysterectomy, you don't have a uterus, so you don't need progesterone. And technically, that doctor is correct. You don't need it because you don't have a uterus to protect. However, progesterone is so beneficial for your sleep, your mood, your brain, your bones, and it helps to balance estrogen's stimulatory effects. So I'm a big fan of both of these hormones. imbalance. So if you are on estrogen HRT and you're experiencing anxiety, breast tenderness, irritability, or even poor sleep, then you may not necessarily need less estrogen. You may need more progesterone. Or if you're not taking any, then you need to get on some progesterone. So some signs that your estrogen may be too high or out of balance, meaning it's you don't have enough progesterone to balance that estrogen, are things like breast tenderness, bloating, irritability or anxiety, heavy periods or spotting, water retention, insomnia, as well as headaches or migraines. And these can occur again when estrogen is high relative to progesterone. It doesn't necessarily mean that estrogen itself is too high. You could still have low estrogen, but if you're not making or taking any progesterone, then you're going to feel the excess estrogen symptoms. I hope that makes sense. I know it's a lot. And when I talk about this, this is a lot of generalized information. This is why it's important to work with somebody, even if it's a coach like myself and my teammate Tanya, where we can really dig into your case. We can help you understand your symptoms and what hormone imbalances you may have. We also look at blood work and really get to know you to help you understand how to advocate for yourself and get on the right HRT regimen. All right. So the other thing I want to talk about are some contraindications for estrogen therapy, because there are some, and you do want to be mindful, though there's a lot of women who think that they can't take estrogen because, again, doctors don't know. There's too much fear. They're still working off of a very old study, the WHI, which was faulty, misinterpreted, and debunked many, many times. But these are some things to consider, and of course to discuss with your provider if you are concerned about using estrogen hormone replacement therapy. So if you have current or recent cancer, like breast cancer or endometrial cancer, you would probably be advised to not take estrogen or stop it if you're on it. Also, if you have unexplained vaginal bleeding, you need to get it evaluated, of course. And then once that is fixed, once that is improved, then you should be able to go on it. But of course, talk to your provider. If you have an active or recent blood clot, especially for oral estrogen, which I actually didn't mention earlier, oral estrogen is another option. I didn't mention it because most women feel better using topical. It is the safer route, but there is some merit to oral estrogen as well. Again, it really depends on the person, what your risks versus benefits are. If you have a history of stroke or heart attack, especially if it was within the past year, doesn't necessarily mean that you can never be on it. Again, talk to your provider. And then if you have active liver disease or liver failure, because estrogen is metabolized in the liver. So we need you to have a healthy working liver if you're going to be on HRT. So again, transdermal estrogen like patches, gels, sprays are generally considered safer for those especially who have a risk of clotting, because it bypasses the liver and it has less impact on clotting factors. The other thing to consider is your body clears estrogen through your liver and your gut. So supporting detoxification is absolutely vital. This is where your lifestyle plays a role. The foods that you eat, hydration, movement, sweating, as well as supporting any sort of nutrient imbalances. So in terms of some foods, you definitely want to consider eating quality animal protein, lots and lots of vegetables and fiber. That's going to help to get rid of that excess estrogen. We love estrogen, but we don't want it to stay in the body. We don't want it to recirculate. You want to use it and then lose it. So cruciferous vegetables are really great for that. Broccoli, cauliflower, arugula, Brussels sprouts. I know some of those are stinky and people don't like them, but put your big girl panties on. These are things that we do need to be consuming regularly to support estrogen metabolism. If you need to take a fiber supplement, that's fine. There's ones that we recommend to our clients. The other thing is you absolutely need to be pooping every single day. It blows my mind how so many doctors and women are not pooping, yet they're thinking about all the other things that they need to do. And it's like, you're not pooping. Like that should be your first focus, right? Don't worry about what supplement to take or what diet or whatever. Your bowel habits are so important because you need to be getting rid of any toxins in the body, any waste, but especially if you're on hormone replacement therapy. You don't want that estrogen to stay in the body. Like I said earlier, you want to, again, use it and lose it. So if you are not pooping regularly, you need to address that. that. And I understand that it's very difficult to do on your own because you don't understand how the gut works, the microbiome. You may not know what nutrients you need. That's why you should consider working with us in the perimenopause method. One of the main things we focus on is making sure that women are pooping regularly. You have to look at your thyroid when it comes to that too, because as you head into perimenopause, your thyroid becomes sluggish. It's going to slow down your gut motility and you may not be pooping regularly. So that's going to impact everything. And then of course you want to avoid alcohol and xenoestrogens in your environment. So plastics, fragrance, pesticides, all these endocrine disruptors that unfortunately we are bombarded with, but you do what you can. You try to avoid what you can control. I did a whole episode on endocrine disruptors, so I'll link to that in the show notes. Make sure you go back and listen to it. So in a nutshell, estrogen is a vital hormone for women's long-term health, whether it's your bones, your brain, your mood, or your metabolism. It is not something to fear or suppress. It is something that we do need to understand, we need to track, and we need to support. So whether that's through lifestyle, food, or HRT, you deserve to feel good in your body in midlife and beyond. Estrogen, when properly balanced with progesterone and metabolized efficiently, can help you thrive, not just survive, after 40. All right, I will see you next week. Hey, before you go, if you're resonating with this podcast and realize that your symptoms are anything but normal, my comprehensive program, the Perimenopause Method, may be a great fit for you. My team and I help women in their mid-30s to early 50s improve symptoms such as fatigue, disrupted sleep, anxiety, erratic moods, bloating, and much more. We do this by utilizing advanced testing, a personalized plan tailored to you, women's health and hormones education, and ongoing support so you never feel alone and you get results. If you're ready to commit to your health and feel like yourself again, but even better, check out the link in the show notes to learn more about the Perimenopause Method. The information provided is for educational and informational purposes only. I am not, nor do I act as a doctor or any other medical professional. I am not providing healthcare, medical services, or attempting to diagnose, treat, prevent, or cure any physical, mental, or emotional disease or condition. The information shared is not intended to be a substitute for the professional medical advice provided by your own medical or mental health provider.